Hi, this is Julia Walker with Grey Duck Forge, and today we're going to be reviewing bone anatomy. Types of bones, the basics of how bones are formed, regions of bones, and all their main structures. My goal today is to cover all the fundamental knowledge a farrier should have regarding how bones work. So with that, let's take a look. We'll start out with the 5 types of bones. The diagram on the right has all the main bones of the horse color-coded by type. On the left, we have the types of bones in order of importance to farriers, of course. First, long bones, like the cannon bone. Those are bones that grow extra length in a specific direction, generally off of a growth plate. Then we have short bones, like the bones of the hock or knee, which are small, often cube-shaped or rectangular-shaped bones that help take a bunch of load in high-force joints. Next, we have the sesamoid bones, like the navicular bone, which are usually kind of embedded in tendons or ligaments or sometimes even muscles to help increase the surface area of a joint. You'll also see a couple other sesamoid-type bones, like the accessory carpal bone or also even the patella. Then we have flat bones, which are bones that protect cavities. The skull is kind of a classic example of a flat bone. And lastly, there are irregular bones, which are basically just the vertebrae. They have weird shapes that can't really be classified in any way other than irregular, so there they are. Cool, and those are the 5 types of bones. Next, we're going to talk about bone formation, or what is referred to as endochondral ossification. Kind of 2 big words, but endo means within, chondro means cartilage, spoiler alert, and chondro, meaning cartilage, shows up in a lot of places for farriers, like in the ligaments that connect the collateral cartilages to the rest of the internal foot, like the chondrocoronal, chondrocompedal, tendinous, ungular type ligaments. And then ossification means turning into bone. So the main takeaway for why bone formation is called endochondral ossification is that bones start off as cartilage, which then later turns into actual bone. Growth plates are made of cartilage. That's another huge fun fact for you. And that ossifies or turns to bone, which is what happens when a growth plate closes. Now, bones grow in 2 main ways. They swell in size, kind of growing outward from kind of the center in like kind of all directions, proportional to their original shape for the most part. Not all bones have growth plates too, but if they do, that's also a big area for bone growth, growing off of them in a specific set direction. Long bones are a type of bone that have growth plates specifically, so not all bones do have like specific growth plates. Cool. But speaking of growth plates, when the growth plates of the leg close is really important information for us farriers. So if we trim in a way to try to improve the direction of growth of a specific bone, it's important to know if we will be affecting other bones in the process, right? So growth plates tend to close starting with the most distal ones. So the coffin bone is closed when a foal is born, and then at 3 months, the short pastern bone closes. So this is P3, that's 0 months. P2 is at 3 months. P1 here is at 6 months, that long pastern bone. And then M3, the cannon bone, is going to be at 9 months. You can see that the growth plates are on the proximal ends of the phalanx bones, kind of up on this side, that top side. But the growth plate on the cannon bone is on its distal end, just something to note. You'll also note that the hind legs close up a little bit before the front legs. The tibia closes a little bit before the radius, once you're up above that knee and hock, another little fun fact. But these times are functionally very important for us to know if we're attempting any corrective work on foals to try to straighten out any legs. Because if you try to straighten out the long pastern bone before the short pastern bone is closed, you might end up making the short pastern bone crooked in the process of trying to straighten out the long pastern bone. Very important thing to be aware of. Now, long bones, the standard sort of bone we'll be talking about, have a few main regions that we need to know. It's a little more complicated than this in reality, but for our purposes, this is the main facts that we need to know. A growth plate is also called a physis. And then the region in the middle of a long bone is called the diaphysis. And then on the ends of bones, those are called an epiphysis. Remember, E equals end equals epiphysis. That's one way to remember it. Or an epitaph is the saying they put on your gravestone, which is at the end of your life. However you want to remember it is fine. I'm just giving you options, but there you go. Now we can talk about external structures of the bone. Firstly, the most external structure there really is on a bone is the outer coating, called the periosteum. That's like the skin of the bone, which, like, on one hand I hate, but on the other hand it's the most useful way to think about it. The periosteum is important. Damage to the periosteum can lead to an exostosis, or extra bone being thrown down onto the area, creating a lump. Usually these are just blemishes, but sometimes they can show up in inconvenient places and cause lameness. So then next we have the articular cartilage. That's cartilage that covers the ends of a bone, or the surfaces where the joints articulate. The cartilage cushions the bone and reduces the likelihood of the bone being damaged. But when forces become too great, damage to the articular cartilage can lead to bone growth inside the joint, like this, which can ultimately cause a joint to fuse, as this bone growth scrapes the cartilage on the other bone, which then leads to more bone growth, and then more bone growth, and more bone growth, and then pretty soon, bam, right? Not a good thing. We can also see a dot on the backside of a lot of long bones, and that is how blood gets into and out of the inside of a bone. Nutrients travel through the blood, and so that dot or hole is called the nutrient foramen. I don't really know what foramen means, but nutrients, blood, there you go. The type of bone you can see when you're holding a bone, like that hard, like boniness, that's compact and tough, and doing all the things that we normally think of, that's called cortical bone. Like, that's sort of the material that hard bone is made out of. And we'll talk about the difference between cortical bone and cancellous bone, what we're comparing it to, in that next slide. So here we can see the internal structures of a bone. Long bones often have a cavity on the inside, called the medullary cavity, which gives the blood supply room to move about as it comes in that nutrient foramen, to be the nutrient supply for the bone. The medullary cavity is also the place where bone marrow lives. So if you've ever bought like pre-cut soup bones at the grocery store, you may have seen a kind of hole in the middle. Sometimes that hole is filled with like a porous or spindly type of bone that's partially filling the center, and you can't really knock it out with like a knife or anything, like it's very much bone. And that porous, spindly type of bone is called cancellous bone or spongy bone, which is sort of like cancellous bone and cortical bone are the two kind of materialistic types of bone that we see. So, yeah, and that cancellous bone is found on either end of the medullary cavity, or if the medullary cavity is small, it might fill the whole thing, but the middle of that medullary cavity is typically more hollow to make room for lots of bone marrow and blood supply. And then, on the inside surface of that cavity, we have the endosteum. Remember before how we said that endo word means within? Well, that's true here as well. It's like the periosteum, but inside the bone. You could maybe think of it as the bone stomach lining. You don't have to if you don't want to. Regardless, the periosteum is like, if the periosteum is the skin on the outside, the endosteum is the skin on the inside. You can almost hear the word in endosteum. So think N equals in. Cool. You can also see that the nutrient foramen is sort of like the pipe that connects the inside to the outside. And it tends to be small, so the next time you get to do a dissection, go looking for it. It's kind of a fun little side quest. So there you go. Those are the internal structures. And this is just a summary of all the main structures in a long bone that a farrier should be familiar with. Injuries to any of these sites can affect the shoeing a given horse needs, so feel free to save this for your own study purposes. You can block off the words on there and then fill them in for yourself. Make sure you can label these. Lastly, a quick word on Wolff's Law. It's the rule that says that bone grows where the forces are applied. The body is constantly growing more bone cells to replace old ones, and it only puts down bone cells where it feels like it's needed. That means if bones are subjected to off-balanced forces, the bones might become lopsided over time. And this helps strengthen areas that are highly used, but can also make crooked legs more crooked as time goes on. It also comes with a small exception, which is like when bones are subjected to ridiculously high forces over long periods of time, they can start to get resorbed or degenerate. So navicular disease, degeneration of that navicular bone is kind of an example of that taking place. But that's more like damage to the bone. So anyway, just something to think about. Horses' bodies replace all of their bone cells every 5 years, roughly. So the oldest bone cell in a horse is only ever 5 years old. Their bones respond to their environments, which includes the sort of trimming they receive and shoeing, how balanced their feet are, how balanced they're moving, all that good stuff. This also means that a massive change in balance in a single trim can sometimes have the unintended consequence of making a horse sore. So as bones that have become lopsided are suddenly starting to pinch each other when the leg is forcibly straightened out, that might not be a good thing for the horse's comfort at that time. So sometimes bony changes are involved, making a horse's hoof imbalance a bit more deeply encoded than one would hope for. So if you're buying a horse, get one with straight legs. That's the moral of the story, and keep a good farrier, right? So anyway, time to review, and for that I made a quiz. Super fun, so save these questions if you want, and I'll write the answers down as we go. And let's jump in. So first question, what are epiphyseal plates made of? Well, epiphyseal plates are also known as growth plates or physes. Remember, a physis is also like the location of a growth plate. And they are made of cartilage. That's a fun fact. If you only learned that in this video, perfect. That's a good thing to know. Hopefully you learned more than that. But what type of bone is the short pastern bone? Well, we know it has a growth plate that closes when the foal is 3 months old, and growth plates should make us think of long bones. I included that because it has the word short in it, which sometimes confuses people, but it is a long bone. What is another term for cancellous bone? It's the kind of that spindly, porous type of bone that fills the ends of that cavity in the middle of a bone, that medullary cavity. So we can also call it spongy bone. How old is the oldest bone cell in a horse? We just talked about that. It's approximately 5 years old. And then when does the growth plate on P1 close? Okay, remember, it's kind of like +3, right? 0, 3, 6, 9. So 0 equals P3, 0 months. 3 months equals P2. So then 6 months equals P1. And then 9 months equals M3. Cool. Very important to know. And then, what is the science-y word for the middle region of a long bone, right? We were talking about the growth plates being like called a physis, and then the ends being called the an epiphysis. So that means we have one term left, if you can remember it. The middle of the bone, the shaft of the bone, that is called the diaphysis. You know, think about a diamond being found in like some rock, right? Middle. That's the diaphysis. Great job. There you go. And that takes us through our basics of bone anatomy for farriers. So thanks for sticking with me. Great job carrying through to the end. I'll be continuing on with this series in the next video since we still have to review the anatomy of synovial joints, and then we'll be nearly through this bones and joints series. I might do a video on bone problems and or joint problems, but that could also be pushed off until I go through diseases a little while down the road. So if you want to see that sooner, let me know in the comments, and I'll do it in this series. Otherwise, I'll plan to get to it eventually farther down the road. But as always, if I made any errors in this video, please let me know, or if you have any feedback of any kind. Thanks for tagging along with me to bust through a pretty dense topic. You guys are rock stars. I'll see you in the next one. Stay safe out there, and as always, stay tuned for more.